Did you know that up to 70% of women performing pelvic floor exercises are doing them incorrectly? That means they're not getting the benefits they should be getting. Today we're going to talk about pelvic floor exercises. Hi guys, I'm Dr. Peter Aziz. I'm a urogynecologist and pelvic surgeon. Today I'm going to describe pelvic floor exercises correctly, why they work, when you should be doing them, according to our evidence-based information. By the end of this video, you'll have a complete understanding of pelvic floor exercises and how to use them effectively for your pelvic health. So let's get started. Before we go into a lot of details, I need to explain what pelvic floor actually is. It's basically a group of muscles that sit at the bottom of the pelvis. Think about it like a supportive hammock that, stretches out from anteriorly by the pubic bone to your tailbone in the back. They provide support for your organs like the uterus, vagina, bladder, rectum, and help the functions. So there are three critical functions for the pelvic floor muscles. Number one, again, provide structural support for the pelvic organs, keeping them in proper position so they don't fall out. Number two, control bladder and bowel functions, helping you maintain continence and preventing leakage. Number three, they play an important role in sexual function. So when these muscles get weaker or damaged, you start developing pelvic floor disorders. That includes urinary incontinence, like stress incontinence, leaking urine with coughing, exercise, sneezing. Includes prolapse when the uterus and the vagina, they start falling down. Or you can also have some problems with your bowel functions or sexual dysfunction. So just like any other muscle in the body, pelvic floor muscles are important and can be strengthened through targeted exercises. And the research is clear. These exercises work. According to the American Urogynecologic Society, pelvic floor muscle training is one of the most effective conservative treatments for stress incontinence and can significantly improve symptoms of prolapse. They are evidence-based, they're supported by high-quality research, and again, when performed correctly, they can prevent the need for surgery or medications in many cases. But here's the key. They have to be done correctly and consistently. So how effective are they? Let me give you the actual numbers. For women with stress incontinence, meaning the leakage with coughing, sneezing, laughing, you can have reduction in your leakage episodes by up to 50%. That's based on data from the American Urological Association. For mild to moderate prolapse, pelvic floor training can improve your symptoms and quality of life. It's not going to make it better, but it might prevent the progression of prolapse. That means you're less likely to have surgery. Also, for women after childbirth, starting pelvic floor exercises early can reduce the risk of developing incontinence later in life, especially for vaginal delivery. These are real benefits. However, you only get the results if you're doing them correctly and you're sticking to them for the long term. So now, pelvic floor exercises, not an option for a lot of people. Severe cases may still require surgery or other intervention. But even in these situations, you can have some benefit from it. However, it's not going to be as effective. So who should be doing these exercises? Pretty much anyone. Anyone can benefit from them at some point in their lives. Consider them if you have urinary incontinence, especially stress incontinence, like leaking with sneezing, coughing, laughing, exercise. If you have pelvic organ prolapse, you feel heaviness, discomfort, bulge in the vagina. If you've had a vaginal delivery, definitely a good option. Or if you want to prevent pelvic floor dysfunction in the future, that's also an option for you. Even if you don't have symptoms right now, pelvic floor exercises can be preventative, especially if you're planning pregnancy, if you're going to have a vaginal delivery, or if you do a lot of heavy lifting for work, or you do high impact exercises, or for women who are approaching menopause. So now the most important part of the video, how to perform them correctly. This is where most people make mistakes, so pay close attention. Step number one, you have to identify the correct muscles. Make sure you are contracting the right ones. So how do you find them? Think about it like you're trying to stop urine midstream. Like you started peeing, halfway through, I want to stop it. Or imagine yourself trying to prevent passing gas. These muscles that you're squeezing to do that, those are your pelvic floor muscles. You should feel a lifting or a tightening sensation around the vagina or around the anus. Very importantly, do not squeeze your buttocks. Your butt cheeks should not be squeezing those. Your inner thighs or your abdominal muscles. This is not your pelvic floor. Abdomen should be relaxed. Buttocks should be relaxed. Focus only on that internal lift. Step number 2, the contraction technique. Once you identify the correct muscles, here's how to contract them properly. So squeeze and lift these muscles as if you're pulling them up and in. Hold that for about 10 seconds. Don't hold your breath. Keep breathing normally throughout the exercise. Then relax completely for 5 to 10 seconds. The rest period is just as important as the contraction. So that's 1 repetition. Step number 3. Now do the exercise program. So perform 10 repetitions 3 times per day. Hey, if you're able to get all of the 30 contractions in one time, perfect. But for ease of use, you can spread them out through the day. You can do these exercises in any position, lying down, sitting, or standing. Usually it's easier to do them lying down, and as you get stronger, you can start progressing to sitting or standing. Step number 4 is optional. You can add some quick contractions. So after you're done with the hold, do some like rapid squeeze and release contractions lasting up to 2 seconds. You can do 10 of those after your set of strong holds. This pretty much can improve your fast twitch muscles response, which is important for preventing leakage during sudden activities like coughing or sneezing. So let me tell you the most common mistakes I see with patients in my practice. Mistake number 1, bearing down instead of lifting up. Some women, they start pushing down, which is actually completely opposite of what you want and can worsen prolapse. Always focus on the lift. Mistake number 2, holding your breath. Just breathe normally, because if you hold your breath, it increases the pressure inside of the belly, defeats the purpose. Mistake number 3, tensing the wrong muscles. Don't clench your buttocks, your abdominals, your thighs, only your pelvic floor. Now mistake number 4, which is the most important. Consistency. Pelvic floor exercises only work if you do them regularly. Either, again, you can do all 30 at once or 3 times a day. It needs to become a habit. And don't expect to see results right away. It takes time. Just be patient with it, stick to it. You're not going to feel anything until probably 10 to 12 weeks. Most of the time you start feeling the noticeable improvement anywhere from 3 to 6 months. Just keep in mind, pelvic floor exercises, not a quick fix. They require commitment. You're retraining and strengthening muscles that may have been weak for years. Even once you achieve your goals, you cannot stop completely, because if you stop using them, the muscles get weaker again, then you start having symptoms again. If you want the fastest treatment for pelvic floor dysfunction, then that's a completely different treatment, and maybe exercises are not right for you. So if you've been doing them consistently and properly for about 6 months and you're still not seeing results, maybe it's time to see a specialist, a urogynecologist, someone trained in pelvic floor conditions and surgeries, and they're gonna basically offer you additional treatments in addition to exercises, because exercises have not been working for you. The most important thing is your quality of life. If you're struggling, don't wait, talk to a doctor, make sure you get the care that you deserve. Just be patient with yourself. It takes time to see results, but the results are worth it. If you found this video helpful, please give it a thumbs up, subscribe to my channel. I always do evidence-based videos on female pelvic health, a lot of urology health, general wellness. If you have any questions or topics you'd like me to cover, leave them in the comments below. Thanks for watching. I'll see you in the next video. This is Dr. Peter Aziz.